Thank you, Catherine. So good afternoon, everybody, and thanks for the opportunity to have this conversation with you. My name is Chris. I am the Head of Quality Improvement and Innovation at the Care Trust, but I'm also a pharmacy technician by background, so that previous presentation really resonates with me, so congratulations to those guys. We're just going to share our journey about how we've embedded QI into our trust and our organisation, and I'll let Mary introduce herself. Over to you, Mary.
But we can't hear you, Mary. It doesn't look like you're on mute. Are you on mute now?
Any luck now?
Yes, yeah.
Oh, that's weird. Yeah, all I said is that I'm sustainability officer in the trust. So we're going to try and do a double act for this. So it may or may not work. We'll see. I will just attempt to move this slide on. Just bear with me. There, right. So just a bit about who we are to start with. So we are Bradford District Care Trust. We are a provider of award-winning, high-quality mental health, community, dental, learning disabilities services. So we cover quite a broad area. Down in this map, you can see Bradford City Centre at the bottom of it, all the way up through the Yorkshire Dales, including places like Settle and Ingleton, if people know the Yorkshire Dales at all. So a very diverse and quite broad area that we cover, and within that we have our two mental health inpatient units as well. I will hand over to Chris about what we do already in terms of QI.
So we've been on our improvement journey for about 6 years, well, 5 years when we started this SusQI Journey as well. So we had a reasonably well-established QI methodology called the Care Trust Way, although I do still keep trying to describe that as we're still in its infancy compared to a lot of organisations. But we have an improvement methodology based on the Virginia Mason methodology quite loosely, but we don't subscribe to any particular methodology. So we've got Care Trust Way champions, Care Trust Way leaders, and then Care Trust Way practitioners. But we'd already recognised the importance of a few other sort of tag-ons that we needed to put into our methodology. So we recognised coaching as a really important part of that methodology. So we had an offshoot to coaching. Innovation is also a really important part of that methodology. So we had an offshoot to innovation. And we'd started establishing our green plan and thinking about sustainability. So we'd already connected in with that sustainability program and the sustainability guys, but we knew we needed to do more. So we started to think about how we could do that, and I'll let Mary tell you the rest of that journey.
So in terms of sustainability, we're already doing quite a bit as well. So we had our green plan that had actually been in place since 2021, and we refreshed it last year. So it was rewritten, and we've just doing our annual review of that as well. We have a network of our green leaders, which is staff from across the trust who have a bit of an interest in sustainability and want to do bits and bobs in their area. We do a monthly green newsletter, and we offer the carbon literacy training free in-house to all. It's open to all staff, so we encourage people to do that, or because it's quite a time commitment, if they can do the shorter one that's available to everyone on ESR instead. So in terms of QI and sustainability, we were doing a fair bit already. I'll hand back to Chris.
So, but we know we needed to do more. We wanted to do more, so we thought about how we could do that, and then we got in touch with the Centre for Sustainable Health and the SusQI network. And then we thought about what does this look like and how do we start to go down that journey of being a beacon site. So we looked at our national drivers, our low carbon emissions, and had those conversations, much the same as probably we've all done, because these conversations are important, aren't they? But the challenge is how do you connect the dots with these things? So we started to align our ambitions with our organisation and made sure that sustainability was built into the way we do QI and how we do QI, and I'll come on to that in a little bit more. But this process started in April 2024 about becoming a beacon network and how we could do that moving forward. Have a look at the next slide, please, Mary. So all our staff, so Mary and the guys in the sustainability team and all my QI leads have gone through the Centre for Sustainable Health SusQI training, the trainer one. We're starting to look at our training and how we embed sustainability right into the training. So the sustainability formula, all those kind of things, and making sure that it was integrated into everything that we do. We have what we call measure success. People recognize that as the domains or the metrics we use to measure improvement projects. So we already did the quality, cost, delivery, safety, morale, the usual ones. But we added 2 more into that. We added a sustainability metric, and we added an EDI metric in there, because we thought it was important that every QI project we did had a sustainability lens on it. So we make sure that in our measures for success, we have a sustainability metric in there. And actually, we really talk about how we embed this into the current practice of quality improvement and how we do that. And we start our quality improvement conversations with what we call a waste walk. So we try to really layer the sustainability lens over that waste walk. So when teams first start going out and looking for opportunities to improve and do that waste walk, there's that sustainability lens that lays over that and really does think about how do they tackle those sustainability challenges when thinking about QI. And we've also tried to build an app now that just tracks all that in the background for us. So all our metrics, all our QI projects are all registered on an app, and now we can just track that across the organisation so that we can start. We've got our ambition that we want to build our big carbon cloud, and we can track all our carbon savings across that carbon cloud. So that's future progress for us and how we track that in all our QI projects. Back to Mary.
So challenges and next steps. I guess one challenge that isn't on here is that everyone's really, really busy, especially Chris's team in quality improvement. So Chris has always got loads of great ideas, but it's finding the time to take those forward. And one of the obviously ongoing issues with sustainability that it is everyone's problem, and then it ends up because of that being nobody's problem as well. So no one is kind of taking it on. Everyone knows that there's a lot of pressures in the NHS at the moment, so sustainability is often kind of at the bottom of the pile. But as a little sustainability department, we kind of keep trying to get it up there on the agenda. In terms of next steps, it would be great, as Chris mentioned, to be able to measure the changes that are being made in terms of carbon saved. So we're going to try and work out a way of doing that. Want to embed this as business as usual, so that it just happens, so that sustainability, when you're doing a quality improvement, just happens naturally within that. As Chris mentioned, it'd be great to have a register of everything that's going on in the trust, because we don't always know about all the QI projects, so we're not able to see kind of where sustainability might fit in really nicely. We haven't got our beacon site status yet, but we hope to by the end of 2025. And that is the end of our presentation. So I'll hand back to Catherine for questions.